My name is Angela Cross and I am a lecturer in the Directorate of Medical Imaging and Radiotherapy at the University of Liverpool. In this podcast, I would like to tell you about radiotherapy and how you can study radiotherapy in the School of Health Sciences here at the University of Liverpool. We offer 6 vocational degree programmes in the School of Health Sciences. These are, as you can see, adult nursing, physiotherapy, occupational therapy, orthoptics, medical imaging, or you may know it better as diagnostic radiography, and radiotherapy. In addition, we also offer some postgraduate programs. So what is radiotherapy? What do you already know? Do you know anybody who has had radiotherapy? On the left-hand side of the slide here you can see a cancer cell, and on the right-hand side is a computed tomography image of a patient's head showing a tumour highlighted in their eye. Radiotherapy is the treatment of cancer using ionising radiation. Here you can see a picture of a typical radiotherapy treatment machine known as a linear accelerator. These treatment machines produce high-energy X-rays used to sterilise or kill cancer cells. So what is cancer? Cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Once a cancer, or primary tumour as it's known, starts to develop, it has the potential to spread throughout the body via the lymphatic system and or the blood system, producing secondary tumours or metastases. There are more than 200 types of cancer, and cancer can develop in any cell type in any part of our body. More than 1 in 3 people will develop cancer during their lifetime, and the risk increases with age. However, due to a better understanding of cancer and more effective treatments, at least half of people diagnosed with cancer survive and are either cured or are able to live with their cancer. Thinking back to our definition of radiotherapy, what do we mean by radiation? Radiation is energy that travels in the form of waves, known as electromagnetic radiation, or high-speed particles. The electromagnetic radiation has no mass and spans from very low to very high energy. We call this span the electromagnetic spectrum. Within this spectrum there are 2 types of radiation, ionising and non-ionising, and it is the ionising radiation that we use in radiotherapy. On this slide you can see the energy spectrum. On the spectrum you can see that X-rays and gamma rays, which are both used to treat cancer, can be found at the high frequency end of the spectrum. Ionising radiation is so high in energy that it can break chemical bonds, meaning it can change or ionise an atom that interacts with it. When ionising radiation passes through tissues of the body, it has enough energy to damage DNA in the cell nucleus, so that it can sterilise or kill cancer cells. Normal body cells may also be damaged. In many cases this causes no problem, but in others the cell becomes abnormal and may later become malignant. The patient. The science of radiotherapy is obviously very important, but we must remember that we are dealing with people who have cancer and who may be feeling vulnerable and anxious. So radiotherapy is very much a profession of 2 parts, the science and the patient care. By clicking on the link you will get more information about caring for the patient who is undergoing radiotherapy for cancer. Radiotherapy is tailor-made for each patient. Before treatment starts, the patient will have his or her treatment planned. Frequently, this involves the use of computed tomography or magnetic resonance imaging to localize the tumor. This then allows decisions to be made on various treatment factors, such as the number of X-ray beams that will be used, the dose of radiation to be given, etc. This slide shows a CT scanner being used in treatment planning. At the University of Liverpool, we have a CT scanner which the students learn to operate safely and accurately in a safe and controlled environment. Once all the information has been gathered, it is fed into a specialist treatment planning system. Radiographers can then manipulate the images to produce the best treatment plan for each patient. This slide shows a CT slice through the chest showing a lung tumour seen here in red. The treatment planning system can manipulate the image to ensure that radiation beams will adequately treat all of the tumour whilst keeping the treatment to normal tissues to a minimum. At the University of Liverpool, the students are able to learn these procedures using our own in-house treatment planning system. In order to ensure that treatment is accurate each time the patient is treated, which could be up to 35 daily treatments, many will require other specialist equipment to be made for them. One such example is when treating patients with a cancer in the head and neck region. It can be very difficult for these patients to keep very still for the 15 minutes or so that it takes to complete one treatment, and so immobilisation is very important. Making a treatment shell or mask, such as the one seen in this picture, will help the patient to keep their head and shoulders still during treatment, whilst still being able to breathe and swallow. In addition, any markings required for accurate setup can be put onto the shell rather than the patient's skin. All student radiographers learn how to make these treatment shells, and many patients need some considerable support by the radiographers during this process. Therefore, good communication skills are extremely important. Patients usually have radiotherapy on a daily basis. This may be just one treatment, but is more often daily treatment, Monday to Friday, for between 4 and 6 weeks. Saturday and Sunday are usually rest days. This slide shows 2 examples of patients being set up by the radiographer in the correct position, ready for treatment, using a linear accelerator. At the University of Liverpool, we have a virtual linear accelerator and treatment room known as VERT. This can be viewed in either 2D or 3D. This equipment allows students to practice using the controls of the machine, as well as learning to position patients correctly for treatment away from a busy radiotherapy department, again in a safe and controlled environment, giving them more confidence when they do go on to clinical placement. Many of the clinical placements also have this equipment. So who makes a good therapeutic radiographer? You can see from this slide we are looking for people who want to work with patients in a hospital environment and who are also interested in the high-tech equipment we use. We are looking for caring individuals who work well in teams but can work under pressure and who are willing to support their patients through their treatment and communicate well with everyone in the team. As a result of the Francis Report, a report following investigations into poor patient care in Staffordshire, we are committed to values-based recruitment. This means we seek to recruit students with personal values and behaviours that align with those of the NHS Constitution. These include care and compassion and working together for patients. Briefly, the outline of the programme. It is a 3-year BSc Honours programme. We do also offer a 2 years fast-track programme for those who already have a good science degree. The programme is funded by the NHS. There are no tuition fees. Overall, as a vocational degree, 50% of your time is undertaking academic work and 50% is practicing in your clinical placement. The range of subjects studied include anatomy, physiology and pathology, radiation science and technology, communication skills, oncology, which is the study of tumours, health promotion and education, ethics and research methods. By clicking on the link at the bottom of this slide, you can meet Paul, who describes his experience training to be a therapeutic radiographer here at the University of Liverpool. Entry is via UCAS, so you need to complete a UCAS form. This should include a strong personal statement detailing why you want to study radiotherapy, giving any appropriate work experience, also your clinical observation visit to a radiotherapy department, and any other appropriate information about yourself, such as information about leadership or teamwork. 3 Bs to include 1 science are required at A level, in addition to 8 GCSEs at grade C or above, to include English, language, maths and a science at grade B. Alternative qualifications may be considered. Currently, we do not hold individual interviews. Instead, we invite selected candidates to a selection day, which consists of information giving and also some group work. As you can see, further details can be obtained from our web pages. A clinical observation visit to a radiotherapy department is one of the non-academic requirements. This is an opportunity to speak to staff and students, to see patients treated, and to see if you like the hospital environment. The visit should be a minimum of half a day. We require a clinical visit form to be completed and sent to us as evidence of your visit. This slide shows a couple of photographs of some of our current students. The photograph was taken here in university, but shows the students in their clinical uniform. So, is radiotherapy for you? This slide gives some reasons why radiotherapy is definitely a career to seriously consider if you would like to work in a hospital, if you would like to work closely with patients, but also learn to operate very high-tech equipment. Following graduation, after a period of consolidation, there are many opportunities for promotion and specialism within the field, including opportunities to work in other countries. Career prospects are currently very good, particularly in the northwest of England. A new cancer centre is due to be built in Liverpool, and a proton therapy facility should be completed at the Christie Hospital in Manchester by 2018. Recent graduates have been offered jobs several months before they took their final examinations. The future for therapeutic radiographers definitely is bright. Thank you.